So today's class is going to focus on abnormal pubertal development. Abnormal pubertal development. The rationale for this is that, puberty is a physiological and psychological transition from childhood to adolescence. Okay. And questions about typical and atypical pubertal development are common reasons for presentation to the primary care clinics. And abnormalities in pubertal development can be indicators of severe underlying disorders and can be a cause of significant anxiety for patients and their families. They require careful investigation and follow-up. So this is something you want to pay attention to because the rationale itself says abnormalities in pubertal development can be indicators of severe underlying disorders. And then it also says it's a common reason for presentation. And I always say this, that for your MCCQE1 exam, always remember that common things are common. Common things are common. Okay. So the causal conditions like, delayed puberty, variant of normal or constitutional delay in puberty. And then we also have primary gonadal disorders like, patients who present with, and the primary gonadal disorders, they have congenital and acquired. So the congenital gonadal disorders, we have things like chromosomal abnormalities like Turner syndrome, Klinefelter syndrome, congenital malformations. And then with acquired ones, we have things like gonadal infection, gonadal trauma, gonadal neoplasm. All right. So these are the things you want to pay attention to. And then with the secondary gonadal disorders, we have conditions like patients who present with chronic illnesses, patients who present with malnutrition, and then hypothalamic dysfunction like hyperprolactinemia, patients who use exogenous steroids, and then pituitary dysfunction, patients who present with like central nervous system tumors as well. So these are all things which can cause these abnormal pubertal development from the secondary gonadal disorders point of view. And then you can also have patients who have, issues with precocious puberty. So central precocious puberty, which can be idiopathic or CNS based, like, a CNS neoplasm or hydrocephalus. And then you can also have peripheral precocious puberty causes, where patients can have like ovarian cysts, which are producing some unique hormones, and, patients who have tumors of the ovaries, and adrenal pathology and exogenous sex hormone exposure. Okay. Now, variations of early pubertal development. So these can also present with patients who are presenting with like premature telarchy, premature adrenarche. These are also present. So given a patient in whom there are concerns about pubertal development, the candidate will identify the cause, the severity, and complications, and will initiate an appropriate management plan. So with all these conditions we talked about, you've got to know the reason why or how the patients present, why they present, what are the underlying concerns. And you must also have particular attention should be paid to distinguishing normal variation of pubertal development from symptoms of severe underlying disorders. Okay, and to supportive counseling regarding the psychological aspects and psychosocial aspects of puberty. And then it goes on into the enabling objectives that giving a patient in whom there are concerns about pubertal development, the candidate will A, list and interpret relevant clinical findings, including those delivered from an appropriate history, okay, with a focus on growth and development, nutrition, and symptoms of underlying systemic disease. So this is a very extensive objective, and an appropriate physical exam with particular attention to Turner staging of pubertal development and to signs of underlying disorders. And then list and interpret relevant investigations, including differentials of normal variants from serious urgent underlying conditions, for example, CNS or pelvic imaging, if you suspect a neoplasm. Don't worry, I'm just taking you through what the objective says. Then after that, we pick a condition and we make sure that we master the condition right away. And then construct an effective initial management plan, including reassurance in case of normal variants, okay, referral for appropriate specialized care, like pediatric endocrinology, genetics, neurology, in case of abnormal pubertal development, and supportive counseling. Okay, and supportive counseling to the patient and their family regarding the psychosocial implications of abnormal pubertal development. So, with all that I said, if you take your time and study this objective very well, for you to say that you've mastered the objective, you've got to make sure that you've gone through all these conditions. So please, I'll suggest that you just take a screenshot of the topics there: idiopathic constitutional delay of puberty, Turner syndrome, okay, Turner syndrome, Klinefelter syndrome, gonadal infection, which leads to abnormal pubertal development, gonadal trauma, chronic illnesses which can lead to abnormal pubertal development, malnutrition, for example, in patients who may have anorexia nervosa, right? Hyperprolactinemia, exogenous steroids, central nervous system tumors, precocious puberty, premature telarchy, premature adrenarchy. If you're able to cover these topics, these 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 topics, then you've covered this objective very well. And each of these topics, what you have to learn is the clinical presentation. How am I going to investigate this patient? What are the complications associated with it? What are the other medical conditions associated with this particular condition? And what are the management steps for these particular conditions? Right? If you've not mastered it, then you've not really conquered this objective.